can it address things like, you know, marginalized communities, specific communities, specific even maybe medical needs? How do we work in a group and create that inclusion and that diversity?
Yeah, that's a great question. So the first thing I want to talk about is that the evidence-based research, because it shows it right there. So there's a huge disparity between Black women and white women, and maternal health, in our system right now, and it's a systemic issue. So we've seen in 2007, the first research that we did, a 33% reduction in risk of preterm labor for centering patients, compared to those receiving only individualized prenatal care. And the
Wow.
reduction for African American women was even higher at 41%. So just participating in centering pregnancy groups made their risk for preterm birth just significantly drop. And then in 2012, there was another retrospective cohort study. And what we saw is that there was a 47% reduction for for risk in preterm birth for centering pregnancy patients compared to those only having individualized care. So just knowing right there that the centering pregnancy model and the way it's evidence-based already reduces the risk for African American women is huge. In addition to that, you're breaking any kind of biases you may have by having 10 centering sessions that are 2 hours each and facilitating a way where you're empowering the patients to speak rather than speaking at them. So one of the things we talk about in our facilitation workshop is listening. We talk about equity, diversity, and inclusion, and what that means in the healthcare model and in the pregnancy model, and what kind of underlying bias, subconscious biases people may have just due to the way that society, you know, triggers us and creates things depending on how we grew up, depending on what our parents' beliefs are. So it's an opportunity to kind of revisit what you think and, really have some hands-on activity that can you serve the community in a better way? Is there something that has been triggering you to make this decision that's actually a unconscious bias?
Mhm.
So in our facilitation workshop, we talk about all of that, and it's really an opportunity to give equity to the community that you're serving, and if they're affected by, if they're marginalized or if they're affected by any kind of issues like transportation or food, you're able to address that differently because the whole community is there and
Mhm.
they're able to talk about what's affecting them. And that might not come up in a typical 15-minute appointment. So when you talk about nutrition, they're able to tell you what is accessible to them
Mhm.
instead of what, and then you can work from there rather than this is how you're supposed to eat, but that kind of food might not be accessible to the community that you serve.
Yeah, and it sounds like there is the facilitator who's doing the medical stuff, right? And through listening and understanding, their mind is changing and opening up to more possibilities, having more compassion, maybe practicing a little bit differently. But then there's also the group who can provide solutions for themselves. So it's not all on the doctor, the physician, the midwife who doesn't have the answers to everything. So I would imagine that if we're talking about food or transportation, that the group is actually coming up with solutions and saying, "Hey, maybe this will help," or "This helped me," or something.
Absolutely. And that's where the
Yeah.
community building will come in because they support each other.